terms of mental health, would you say technology is your savior or your killer? My name, as you know, I am Fanny, I am Stefania, and I'm currently studying a major in clinical psychology. So I'm not a total expert in this subject, but I am like living the, the world of telepsychology in my profession. So I want to talk to you about interactions between technology and psychology, uh, how they manage to live and coexist together, and I will tell you why I totally support telepsychology, even with their implications. Okay, so first of all, in pro, um, I want to tell you about COVID-19. Of course, we already talked about that. However, in terms of mental health, um, the, the Journal of American Psychologists, which is part of the American Psychology Association, says that in pandemic, well, before the pandemic, approximately 7% of psychologists would perform their work in telepsychology. It means video call, Zoom, use or recommend their patients some apps or some uh, technological advices in order to support their treatment. But after the pandemic, or during the pandemic, it this percentage would increase in 85%, and 65 approximately percent of psychologists would do all their job in telepsychology. It means they would only consult patients in video calls, in Zoom, in meetings, for apps, etc. Um, what I really like about psychology is that it's less expensive, and it helps victims, for example, of violence, like intrafamiliar violence, because there are sometimes teenagers who can't afford a really expensive therapy, or there are people who can go, for example, if they have internet but they live really far of hospitals or any consultorium, they don't need to travel there. They just connect themselves into a Zoom call, and you can receive treatment. So it is really easy for me as a patient and as a future professional psychologist. So I think in terms of pandemic, uh, telepsychology was our savior. However, there is another part, you, which is the part against. We already know that um, internet addiction exists and social media addiction. There is a disorder, in fact, which is the disorder of internet addiction in DSM 5. Um, we already know that internet addiction increases the risk of anxiety, depression, and stress. As you know, it's a really common periodic and episodic illnesses. However, um, the, the Journal of Family and Community Medicine, which is another journal, says that patients with internet addiction were the most depressed ones and the most anxious ones. That 80% of inter, internet addicts were also depressed, and 83% were anxious patients. So we know that it is not only one disorder, but two or three or more disorders, which are caused by technology, and that as we live now in a world and in a digital world, it is hard to live that addiction, you know. However, I am against, no, I am pro, I am in pro of telepsychology as a way of performing therapy, because I think benefits are more than disadvantages because, first of all, there are also some implications of internet addiction. For example, the responsibility of parents sometimes, the ignorance of knowing how to put limits, and in a beneficial part, there are therapists who can become not like famous or viral, but the ones that have profiles in their social media in order to get more known and to get more patients and to help people to heal in their own process, right? So what do you think? Do you think you'd like to take a Zoom conference but to heal, or you prefer to travel and have your therapy? I don't know, what would you think? Okay, Churi, what would you think?
I don't. I have never gone to a like a therapy, but don't you think like a therapy between the screen is not like it has it lacks of this like connection between the patient
Yeah,
and
the
the
report, right? Yes. In fact, the article that I showed before, the one of Against, yes, it concludes that patients rather face-to-face therapy rather than telepsychology therapy. However, I think 50% of Mexican population is poor, and maybe they don't have access to this kind of therapy. They cannot travel to private hospitals. They need to wait 3 months until IMSS gives them their appointment. So I really support therapy to low costs, but with really professional therapists who can actually help. Thank you so much.